Okay, I think we start the call. Over to you, Tillman. We are waiting for some more participants, but we start now. Thanks.
Okay, thank you, Peter. I wish everyone a warm welcome to our virtual fireside chat, or Kamingespräch, as we call it in German. My name is Tillman Rüppel. I work at MedMissio, and I am also a board member of Action Against AIDS Germany. Today's topic centers around the current cuts in US foreign assistance, focusing on the demolition of US aid and the impact this is having on affected communities and global health more broadly. As you probably all know, in the past 2 months, the Trump administration not only ordered the United States withdrawal from the World Health Organization and stopped the cooperation with UNAIDS and UNFPA, but has also undertaken enormous cuts to official development assistance and completely dismantled US aid, the biggest implementer of bilateral foreign assistance in the world. Secretary of State Marco Rubio recently announced that 83% of all US aid programs are terminated effective immediately. Obviously, and rightfully so, this procedure has sparked numerous legal challenges in the US. However, even though several court orders have already demanded various changes to the Trump government's approach, it is unfortunately completely unclear whether the US administration will abide to these court rulings and to what extent, thereby knowingly risking a profound constitutional crisis. But while these developments are unfolding in the United States, the direct and catastrophic consequences of the decision to slash official development assistance, destroy US aid, and fire countless of staff are already felt worldwide. WHO reports that people are running out of food, countries are running out of medicine, and hospitals are closing because of the slashing of global health budgets by the US. According to UNAIDS, an additional 6.3 million people will die in the next 4 years due to AIDS-related deaths unless support is reinstated. And Africa CDC issued the warning that 2 to 4 million additional Africans are likely to die annually as a result of the shock aid cuts by the United States and other key donors. Following from this, many important questions arise. How deep will the cuts to US foreign assistance be in the long run? Which implications will this have on the affected communities on the ground? What will happen to PEPFAR, which has provided HIV therapy for 20 million people in the global south, as its future hangs in the balance? Is ODA dead, as some critics have called it, considering that other major donor countries like Germany, France, Sweden, Canada, the Netherlands, and the UK are significantly decreasing their ODA contributions as well? And most importantly, is there any way to fill the immense financing gap resulting from these proceedings, especially considering the acute debt crisis many nations in the global south are facing, and the fact that the world's 26 low-income countries, where more than 600 million people live, clearly lack the economic and financial capacities to sufficiently increase domestic resource mobilization? These are just some of the questions we want to discuss with our distinguished guests today. But first, a short organizational information. Today's discussion will be recorded, and this recording will be published. Moreover, this fireside chat will be held in English without any translation provided. Now, and without further ado, I want to give the word to my dear colleagues and moderators of today's discussion, Tanja Siebenbrot and Peter Wiesner.
Yes, thank you so much, Tillman. Hi, everyone. I'm happy to see all of you here. My name is Tanja. I work at DSW in the areas of global health and health financing. And I have the pleasure today to co-moderate this panel together with my colleague Peter. So over to you, Peter.
Yes, my name is Peter Wiesner. I'm the policy officer of Action Against AIDS Germany. I'm a long-term HIV community advocate, I would say. I'm very happy to moderate this session with you, Tanja, and I'm really glad and happy that we have distinguished guests here, and I just say their names now. They have later time to introduce themselves in their own words. So we have with us Christoph Ben from the Director Global Health Diplomacy of the Job Lange Institute. Thanks, Christoph, for being with us. And then we have Valeria Rachinska. Everybody knows Valeria. Thanks so much for being with us. You participated in some of our conferences. It's always a pleasure for us to have you with us. So thanks so much. And you are from the Ukraine, yes. And then we have Tendai Westerhoff from Zimbabwe. Tendai, you are the National Director of the Pan-African Positive Women's Coalition. And of course, you are going to talk about your situation, and you will talk a bit more about yourself later. Without further ado, we start the discussion now. We have 2 rounds of discussions. The time is limited. The first round will be a sort of a state of the affairs. Where are we at the moment from different perspectives? And the second round of questions will relate to what are the next steps? What comes out of that? What can we do? What do we expect? I start with Christoph. Question to you. I noticed you just come from China, so thanks so much for being with us. Not jet-lagged at all, as it looks like. And Christoph, it seems that you have spent your entire life on global health financing. You did work for the Global Fund in the past. I think I can say that. And you have developed plenty of ideas to develop alternative financing mechanisms. So much on your background, and you will talk a bit more about yourself. But now to my questions. So how would you describe from your perspective the current situation on global health financing and the global health architecture? How can we guarantee that the successful structures that we have built up in the past, the structures that basically worked, survive? And this, of course, in particular related to the Global Fund, to PEPFAR, and to UNAIDS. And yeah, how can we guarantee that the structures that we have, that they continue? Christoph, you have only 6 minutes. So much for being with us.
Thanks, Peter. Thanks for inviting me. So this very important and timely conversation, and certainly it feels to me that I spent a lifetime on global health financing. It's, of course, I did something before, but also feels like I've been aging a lot the last couple of weeks, because like everybody else, I think on this call, I've been extremely concerned about what's been going on. We will hear later more concretely from Valeria and Tendai, what's happening at the country level. But like many of you, I've got so many calls and messages over the last weeks that clinics are closed. People, have not had access to their treatment and so on. And we know that so many lives depend on that. So it's been extremely difficult period since this stop work order has been issued by the Trump administration and with the dismantling of USAID. At the same time, we also know that the final decision on which programs will actually be terminated has not been taken yet. It is expected in the next few weeks. And it is hard to speculate on, what will finally be terminated. And I would still remain, somewhat hopeful that the US, with the strong bipartisan support that, particularly HIV/AIDS has enjoyed over 25 years, still will make sure that these life-saving programs will continue to receive funding also from the US. So that's definitely my hope. But you asked me also to look at the broader, picture. It is extremely difficult, and we also know that all these programs that you mentioned, it's PEPFAR, Global Fund, UNAIDS, WHO, they're all intimately integrated. So if you pull out one element, many programs collapse, even if the other organizations can continue. So we need to look at the funding of all of these organizations together. Only then can the whole kind of sequence of, procurement, supply chain, human resources capacity, clinics being run, prevention programs, only function if all elements can continue. And while we are all concerned about the US, I'm equally concerned about what's going on in Europe. And, you know, it really saddens me when I see the cuts in ODA in many European countries. You mentioned some of them. UK announcement. In Germany, we know it's a very critical period right now, negotiating the coalition treaty, a lot of pressure on the ODA budget. The country where I've been living for the last 20 years, Switzerland, rich country, is cutting its ODA. It's devastating, I think, when we see that. And maybe it is a situation where also the world realizes there has been a bit of an over-reliance on the US when it came to HIV funding. You know, they have provided much more than 50% of global finance for HIV prevention, care, and treatment. And that has not been healthy. Other countries, you know, should have done more in the past and should do more now. That applies particularly to Europe. They have to step up, maybe a similar reaction as we have for the defense, you know, budgets, that they see, hey, we can't rely just on the US, we need to step up. That should happen also now with health and development. And finally, yes, I just came from China this morning. We had intensive conference the last few days engaging China on global health financing, looking there particularly at the mechanism of debt swaps. If China could convert, you know, debt to many countries and they could invest that domestically, it would free up fiscal space, for example, for HIV programs. That would be a big step forward. So no decision yet on the Chinese side, but we made this case that it is time for China also to step up, and maybe, you know, debt swaps could be one element. But I've also been 2 weeks ago, I was in Korea, you know, other Asian countries, Korea, Japan, even Indonesia, I think will make a significant contribution this year. They have already pledged 30 million to Gavi, and we hope they will also pledge to the Global Fund. So I think Asia, you know, also needs to play a bigger role, and they can and will probably play a bigger role. Europe needs to step up, and we need to preserve, of course, the US as much as we can, but only jointly can we overcome this really very, very critical situation. Thank you, Peter.
Yeah, thanks so much for mentioning European countries as well. I just come with some colleagues from the German-Austrian conference, where we again, so we're reminded that Austria, a rich country, didn't give anything to UNAIDS and the Global Fund. There was only 1 million in the first years that they contributed. Of course, I don't want to put Austria on the spot, but this is a reminder to us, you know, that we from the Global North could do much more. And I agree with you that we did rely too much on the US. Probably everybody agrees on that. So let's see how this, to what this develops. So over to you, Tanya, unless you have another question to Christoph, but over to you now. Thanks.
No, thank you, Peter. I would like to move on to Tendai right now. So Tendai, you work for a network for positive women living with HIV. So yeah, please share with us how your work is currently affected and what are the on-the-ground consequences of the stop work order in Zimbabwe and in the South African region. And yeah, please describe the situation. How are the people and communities you serve being affected, and what changes have you observed since the order took effect? And also, if you'd like, please share also a few words about your background and what motivates you to be such engaged in this field. Looking forward to your input.
Thank you so much. I hope you can all hear me, and good afternoon, good evening, good morning. Yes, the consequences of the stop work orders at the ground level in Southern Africa are more or less the same. The first issue has to do with this disruption of services. I know at some point there was a bit of a reversal that life services should continue, but already there was some psychological impact and mental health issues related to the concern of possible cutoff of services and commodities. And this becomes a huge issue. Women living with HIV were affected. Issues of stress, trauma, gender-based cases going up. And most women living with HIV who were community volunteers, you know, where it was also their source of income due to lost their source of income due to these work stop orders. And it also resulted in the loss of self-esteem by many of them. For instance, they ended up walking longer distances to access healthcare services. And this is also increasing issues of stigma and discrimination. And also in some cases, the critical HIV diagnostic tests continue to be affected by the low levels across the board, with most NGOs who were providing these services, and the availability of feasible transportation systems. In some instances, public transport is being used to ferry samples to the lab for testing, while HIV testing services could be available. However, other services beyond art continue to be affected. And then the funding that has been taken away, it also means that all those organizations are now going to be looking for funding elsewhere. So there will be bigger competition among us NGOs and an inevitable scramble for the available resources right now. So the meaningful involvement of community engagement in putting communities first to end the HIV pandemic, HIV, TB, and malaria will not suffice in the absence of resources for both monetary and
Okay, Tendai,
side donors. Can I continue?
Yes.
Yes.
Okay.
Yes, sorry, I thought I didn't hear you for a while. I don't know if it was my connection or if it was only, yeah, or if it was for all of
Can you
them.
hear me
for all of
now?
us. Yes, perfectly.
All right, fine. I'll continue. So I was saying that we are also seeing a cut in programs on gender, on gender, on gender equality and sexual and reproductive health. This is just because of not just because of the USAID funding, but also to other donors who have also done the same. I think we heard from the first speaker. Others here may recall that the Netherlands say they are no longer going to be funding SR, HR, and gender equality. So what this means is that maternal health issues become affected. If we are talking about the SDG 5 and the SDG 3 on health and gender equality, those are going to be impacted very negatively, and the path to the SDGs is now an uphill one to most of us. This takes away the rights of women. If we look currently, the UN Women Group states that it will take about 100 years for gender equality to happen. Now with this top work thing, it means that 100 years could be there, and there could be 300 to 400 years for gender equality. So we are going back to 50 years to 100 years backwards because of these cuts. And also there is the issue of adolescent girls and young women, the lack of willingness to acknowledge adolescent sexual health needs, and lack of knowledge and skills. This is also affecting the region. And also in the context of sexual reproductive health and the rights for adolescent girls and young women. And we are also looking at the issues of health systems contexts, whereby the health budgets are really not meeting the Abuja Declaration by most countries in Southern Africa. You know, the Abuja Declaration calls for 15% of health budgets to go towards health, but this is also not happening. And it's resulting, because of this stop work order again, it's also resulting in the poor quality of services, that is happening. And now these US-funded organizations were providing some commodities. In example, I'll give you in Zimbabwe, for instance, PSZ, towards mobilization of young people to get commodities such as contraceptives. Then PSZ would support that. So with this, I'm not sure how much they've been affected, whether they will still be able to offer contraceptives to young people. But for us, because we work with young people, we can see the effects. Our outreaches will be affected, in a lot of ways we can mobilize young people, but if there are no commodities or there are no services for them to access them, it becomes very difficult. So it is a whole lot of impact, and this is also a huge this is and it is so it has a whole lot of impact. And also there is the other issue of, in terms of various sectors that will be affected or that are being impacted by these work orders. Imagine somebody who was renting a house because they were able to pay for the rent, because they were working for USAID project, for instance, then suddenly they don't have the income, which means they cannot rent. It means that person whom they were renting from has lost income, and it could be that house was their source of income, so now they no longer have an income. The person who was renting probably have children that were being sent to school. Now that means those children are going to be impacted because of the lack of income. So this is now at an individual level. And for a lot of people, were being paid salaries through the USAID funded project. Maybe they were supporting their relatives, senior grandmothers, grandfathers, and the extended family, paying for the school fees, etc., etc. All was possible because one was receiving a salary. Now there is no more salary, all that stops. And it's such a huge impact if we look at it in all sorts of ways. So think along those direction. If you can also see it from the Southern Africa region, our problems seem to be almost the same as caused by these US stop orders. And then there is another issue that people are really not talking about, the issues of unclear information, on the ground. It is being said there were waivers done and the likes, but on the ground, we were issued with termination contracts. Some organizations were given this termination contract. Nothing was made clear. In other words, clinics that were being told that they are fully booked so that they could also try other clinics. Then there is also another issue which I have never heard since this discussion has started in various groups. Nobody is talking about the assets that these implementing partners of the USAID grants were using. The PEPFAR grants, no one is sure if these assets should be used or not. And the painful part is that we also do not know or have verified information. No one knows what is happening or what the plan is or what to do with those assets or whose responsibility it is to keep them safe. They can be stolen, they can be damaged, and most of these budgets were cut. They don't even have storage costs. So the global gag rule threatens to reverse these gains, putting the health and lives of countries and women at risk. So on the other part that you asked me to describe the current situation, how people and communities we serve are being affected, I think I've said that there is a significant drop in service provision due to the recent stoppage of work by PEPFAR implementing partners. So substantial service disruptions are also on VIAC and viral load testing due to staff shortages. Cervical cancer screening gaps are also as high as 92%, for instance, in most provinces in Zimbabwe. And last but not least, there is a significant drop in service provision due to the recent stoppage of work by PEPFAR and USAID implementing partners. I'll stop here for now. Thank you.
Yes, thank you. Thanks so much for your input. I think we heard a lot about the devastating situation. Thanks a lot for sharing. So over to Peter, who is continuing.
Yes, thanks so much. Tendai from my side as well. Especially you talked about the stress and the trauma. I really cannot imagine if somebody would tell me, okay, no medicines from tomorrow onwards. This is a trauma. And with these words, I get over to you, or I introduce you now, Valeria, with the same question. So you work for 100% live in Ukraine. You know exactly what trauma is all about, given the fact of the situation of your country, and now stop work orders. What is the impact in your region? We heard now a lot about Zimbabwe and for women living with HIV. What can you tell us from your situation in your country, in your region? And thanks so much again, Valeria, for being with us.
Thank you. So I would say that we one step before the catastrophe. I will be very strict here because this is the truth. Because for us, it's not just some services shutting down, the system is crashing. And we are just witnesses of something that crashed. Russia is happening right now, and we are not able to do anything with this. Because, okay, firstly, we lost access to medications. And first weeks after the stop work orders was really horrible for us because we had medications in country just till June. And when we had talking about mental health issues, you know, when you're in Kiev or in Zaporizhia or Dnipro, any Kiev in Ukraine, and you going to the bed, you never know, will you wake up at morning or not? This is like a question of luck and air defense, let's say like this. And on top of this, you know exactly that you have medications only for 3 months. And then you don't know what to do because actually no one even procured and produced these medications for you. So, and you know how chaotic it was right from very beginning. So we got this news a stop work orders and a waiver, something can start, and then no information what can start and which services or medications will be supported. And then so we were and we still in the situation the biggest uncertainty in our lives, because we really don't know what happened tomorrow. Because in 90 days, somewhere in April, it will be audit conducted with some assumptions what's gonna work and know which medical services will be continued, and we don't know will be our services still included in this. So we cannot say the situation for now is done because it's just the start of everything. So just let me describe shortly the full picture of the damage that we receive right now. Rather than lose our access to medications and actually have a problem still with testing systems and laboratory support, we're losing our staff members. Why? So it's important all over the world, but I think in Ukraine have a super specific focus, because we have a war right now. And a lot of our medical doctors and nurses and people related with healthcare, they just was conscripted to the army. And some of them fled as refugees because of families, because they were afraid to stay and they could do it. So our social workers, they not was just provided some specific services related with testing or adherence to treatment and so on. They took some functions of medical staff. Of course, not treatment of patients, but some nurses, some delivery staff, some consultations that to make life of doctors and all the healthcare workers easier. So, and the pressure on our medical healthcare system was really so huge that doctors felt grateful to our social workers, to our community healthcare workers, to make their lives easier. And right now, we don't have this support because some of our organizations in the field, we manage in 24 regional branches of our organizations. So working in each region of Ukraine, almost. So some of our regional branches should cut 60% of their staff members, 60%. And then this is this significant damage. So on the central level, we cut 25% of our staff. And, you know, and this is big loss of expertise as well, because even if tomorrow everything will be fixed, where on the market you from out of clue, you will find an expert that's ready with the amount of expertise of 15 years and knowing all the details, how to successfully respond on challenges related with HIV and tuberculosis. Rather than this, in Ukraine, we created a comprehensive system of psychosocial support and support of HIV/TB clients, because when the full-scale Russian invasion started, we just only a specific HIV/TB donors, they couldn't do everything. That's true. So we collaborated and brought the projects for overcoming of HIV and TB. WFP that provided our hospitals with the food for their patients and directly supported HIV and TB patients. And what happened? You know, US government was a donor for WFP as well, and they cut their funding as well. And the cut was really significant. So the amount of hospitals went to 50%, like a loss that was supported by food, and the patients as well. UNFPA, we had a project like a mobile clinic on reproductive health, and UNFPA got the troubles as well. We don't know, maybe some of European donors want to support it, but still we are waiting because we cannot continue the services. And this list I can continue, because we created really system that worked and was really comprehensive on human rights, on advocacy, services, support, prevention, and so on. So right now what we are doing, we are sending in the mails to our partners and donors and governments with a message, hey guys, till the end of the year, we need to procure medications and test systems for $1 million just to survive, nothing luxury, just like a necessary stuff. Until the end of 2026, $17 million, because this is what PEPFAR told they're gonna buy. And right now, it's super important to understand procurement are important. You cannot decide, okay, I donate this money for this procurement program today and tomorrow you will have medications. No, it's month. You will have a line, you need to find a producer, you need to find a tender, you need to produce, everything is time consuming. So, and right now in Ukraine, no one started procurement yet. So right now we have medications because we got unfrozen, some programs were unfrozen. We have medications till October, including, but then we don't know what's gonna happen. And we have in our brain right now only negative scenario because procurement hasn't started yet.
Thanks so much, Valeria. Given the time, we need to head on to the next questions, but you provided really good overview, and thanks so much for putting a light on the work of UNFPA, because I think it's not clear to everyone that all these other organizations that suffer under the changes in the US, that they have an impact on the ground. So this is exactly what we wanted to address. So without further ado, we would come now to the second round of the discussion, and this will focus a little bit on the way forward, on the next steps, and what do we expect, what do we want to see. With these words, over to you, Tanya.
Yes, great, thank you. So I move on with Christoph, with you again. So yeah, as Peter already said, we look a bit in the future. So yeah, nobody knows what the future will bring to us, but what developments do you expect? And in your view, what needs to happen to ensure that the existing structures receive the necessary funding and can be sustained over time?
Yeah, thank you. And listening to the powerful statements of Valeria and Tendai, I think it reinforced, why we need to redouble all our efforts to make sure that these programs will be supported also in the future. A couple of points. First, as we said, in the US, we are still waiting for the final decision. We don't know yet which programs will be terminated, and I remain hopeful for now that many of the life-saving programs, addressing HIV, but also tuberculosis, malaria, and other, health issues will be maintained from the US. But secondly, it is not just the US. All the other countries need to step up. This year, the Global Fund is running its 8th replenishment campaign. So they will have a replenishment conference towards the end of the year, co-hosted by two great countries for this, the G20 presidency of South Africa and the United Kingdom. So they are the co-hosts for that replenishment conference. and all the other non-US countries need to step up. For your background, so far it has always been that the US pledged up to 1/3, 33%, basically saying, you know, for every, you know, $2 that other donors are giving, we put in $1. That was the matching, that was the incentive coming from the US. I think now we have to turn that around and say all other countries need to step up. And I think that would also send a powerful signal to the US, how broad the support is from the rest of the world to these programs that need to continue. But regardless of the outcome of the replenishment, one thing seems to be very clear. There needs to be greater domestic support and investment as well. And Tendai mentioned that very correctly. There has been this long-standing commitment towards 15% of investment, you know, domestically into health. Very few countries have achieved that. Now is absolutely the moment for countries to increase their domestic investments in health and also to do their part to maintain these programs. That applies to all countries, lower middle income countries, particularly, of course, also upper middle income countries need to kind of their increasing investments in these programs. And finally, the traditional and what I call the non-traditional donors. Many high-income countries have not, you know, provided their fair share so far for global health, for the Global Fund, for these life-saving programs. Now is the time to show up. There are, of course, you know, also innovative finance mechanisms. I talked about, you know, China considering the use of the debt swap instruments could be one element that China and other countries can also consider. So I would be far from giving up, you know, hope that we can still maintain the finance. We heard why it is so essential listening to the Ukraine and to Zimbabwe, but it stands for many, many other countries around the world. This is absolutely critical. And I think this is the role of all of you who've joined this call today. We need the strong advocacy for the Global Fund replenishment, for these programs, for UNAIDS, for all the other UN agencies that were mentioned, WHO, UNFPA, many others who play a very essential role in that. They all need our strong voice, our advocacy to maintain their programs and to translate that into the services on the ground. So big job for all of us. Thank you.
Yes. Thank you, Christoph, and that you mentioned that it needs a strong advocacy. I think we all agree on that. And so I turn over to Peter again.
Yes, Christoph, again, thanks from my side as well. There was this question around the Finance for Development Aid conference that's coming up, and it would be good to hear from you just in one sentence, how can we bring, or how can we influence the outcome document? Do you see any chances? Maybe one sentence and then we head on.
Right. We have the Financing for Development conference. It's only happening every 10 years. Therefore, it is quite significant. It is a UN member state conference, so all member states will be represented, but civil society can register as well. My team has registered for the FFD conference, and we are planning some activities there. It's not so much, I think, about the outcome document. We've seen the zero draft. It is always a compromise document, but still the conference itself is an opportunity to raise the issues we've been discussing here, the urgency, and why we continue to need funding from all countries that can support these efforts.
And thanks to Robin for the question. And now we Tendai to you basically with the same no, not the same, because you're the first one. So we've seen a shock and we of these developments, and we just wonder how we can come out of this catastrophe with something positive. How can we make solidarity between the global South and the global North work for low-income countries? What are your ideas about that? Thanks, Tendai.
Thank you very much, Peter. I think our governments in Southern Africa should use its organs, such as the SADC, to hold special sessions on the impact of the PEPFAR stop orders. For example, the cuts in South Africa, I was reading somewhere that it was at 17%, way lower than for Zimbabwe, and this could be the same trend in the whole region, in the rest of the region. Therefore, I would recommend for countries to engage in open dialogue so that they will all play a key role in addressing the setback. There is a lot of cross-border movement by people in the Southern Africa region. People living with HIV are affected as they require life-saving antiretroviral therapy, irrespective of which country they live in Southern Africa. So achieving health sovereignty for countries and our continent is among us the key aspirations of the African Union's Agenda 2063. And I'll take you back at the AIDS conference in Munich. The German chancellor or the president, I can't remember what he's called. He spoke on leadership, policy, and funding, and that there was a global initiative to eliminate HIV, stigma, and discrimination. This was said in Munich, and as Munich was actually identified as the fast-track city. So we need to make use of the global parliamentary platform on HIV and AIDS to mitigate some of these issues that have come out because of the PEPFAR funding. And also there is also need to prioritize the existing resources that we have by ensuring that there is access to treatment, diagnostic services, including HIV advanced disease. And there is need to continue engagement with funding partners, including PEPFAR, on the need to ensure the continuity in services as the withdrawal of supported staff based on data collected has shown to have had an impact on overall service delivery. I said that in my first response. So all what I can say is that we must continue to engage our ministers of health at all levels to share client perspective and identify strategies to address noted gaps and challenges as a result of these work stop orders. We need to be calling on governments to invest more on health because it is a human rights issue. The lack of human rights is a human rights violation. So we need to ask our governments to then invest more on health, to invest more on gender equality and women's economic empowerment. Thank you.
Wow, what a strong statement. Thanks so much. I mean, I couldn't agree more. I in particular liked the word health sovereignty, but this entails as well that we need leaders that are reliable, and we need sustainability, and this yeah, this is something that we probably don't have in many countries, but thanks so much for your statement. And with these words, over to you, Tanya.
Yes, thank you. I also couldn't agree more. Thanks a lot for this passionate speech. And now I'm moving to Valeria. Valeria, in light of the significant disruptions to your support structures, what do you need from us, your civil society partners at this critical juncture? So yeah, what forms of support do you expect from us?
I could send you our long list, which kind of support we do expect. We already calculated everything. So, but to be serious, of course, it's support with finding new sources of funding, yes. And I want to say like a huge thank you for all the activists actually all over the world that fighting right now for like keeping our programs like running. So European activists, like a huge thanks to American activists, and I saw all these protests, like, you know, so we are thankful already for this. So for like international civil society fighting for the lives of people in need. But you know, like what I can tell, you know, maybe I'm not unique here, like, but I have super easy solution. Fund, global fund. We don't need to invent some bicycle again, because everything already invented and created. We have like an independent financial mechanism with a huge technical expertise, with a huge amount of donors that actually can easily donate. And even some like not decisions that I don't want will be made like on the higher level. So I do believe that all the global leaders can sit down and discuss how financially they can cover this gap. And I know what I'm talking about, because you know what didn't disrupt in Ukraine this year after stop work order? It's Global Fund. All the services were provided, all the gaps was covered by Global Fund, all the social workers were there and so on. And what happened when the war started back 2014, like a first time? Who was in support of occupied territories, frontline, and so on? It was a Global Fund. And this was medications, test systems, human rights, communities development, and even like a psychosocial support to implementers from the, let's say, headquarters. What happened in 2022 when the full-scale Russian invasion started? Who stepped in? Global Fund. And, you know, with all my respect for all the saved lives, from USAID and so on, USG told that moment that we cannot redirect our money for humanitarian projects. It's not possible, so you have a sticker. Who told us yes? It was a Global Fund. So I think leadership, it's not just to be a kind and nice guy or government or institutions just when everything is all right. Your ability to be a leader, it's when you're a leader in a really bad situation, in a crisis. So I think it's a time for all the global leaders to show their real leadership and save us. About 40 million people living with HIV all over the world, and save a more 100 million lives all over, because people will not get infected. So only one right decision: to be a real leader and do right things. Fund the Global Fund. Thank you.
Thank you so much, Valeria. I think all of us cannot agree more to fund the Global Fund. And thanks a lot for highlighting all these points. And now, Peter, do you have any more questions to Valeria? Otherwise,
no, Valeria, thanks so much. Thanks so much for mentioning the Global Fund. I'm sure there's a latest statement where you probably mentioned the financial support of the German government as well. We haven't paid you for that statement, so it really came out of your heart. So thanks so much for being such an activist. With these words, over to Tilman for the last sequences and summary and last questions. Tilman, over to you.
Okay, thank you for handing over to me. And also a huge thank you to our esteemed speakers for sharing their expertise and perspectives and very powerful messages. To end our fireside chat, I have one final question for each of the participants. In the past hour, we have heard a lot of negative news about the state of global health, and that is why I want to kindly ask you if you can shortly present a positive vision for the future of global health. Christoph, please go ahead first with your answer, and I give you 1 minute for your response.
Thank you. But I have to thank also, Valeria, what a powerful statement. It was heartwarming for all advocates for the Global Fund, what you just said. On the final one, the positive one, let me close with a quote attributed to Churchill: "You never want a serious crisis to go to waste." So let's look forward, that we can really maintain these life-saving services around the world, in the Ukraine and Zimbabwe and all the other countries. If the African countries step up to the 15%, it will be a huge step. If all middle-income countries step up their co-financing, it will be a huge step. If the Global Fund replenishment end of the year will be successful, and we will all work hard to make it successful, the programs can continue, as Valeria reported in the Ukraine, as it has been so many times when it was at great risk. And then I'm also moderately hopeful that the US will not terminate these programs, but they will need to see also what the other countries are doing. As long as they feel, oh, it's us who has to pay for everything, they will stop that. The world has to show solidarity now. If it does, I'm confident the US will not leave us alone in this fight against AIDS and the other infectious diseases. Thank you.
Okay, thank you. And Now, Tenda, it's your turn. You have 1 minute.
Thank you very much. So all what I can say is that we live in a global village and no single country lives in isolation with the rest of the world. Therefore, global solidarity is important at this crucial time. Just like what happened during the time of COVID-19, countries quickly came together and acted irrespective of those who have and the have-nots. We beat COVID-19, and I think as part of global solidarity, we must continue in the same spirit to save lives by ensuring that there is funding and health services are not disrupted, as disruption of health services has an effect on almost everything in any economy beyond just health. Thank you.
Thank you very much. And now, Valeria.
You know, like I don't actually know what to add more, but like look, I'm a woman living with HIV, and this is my medications, and I need to take it each day. And each day, I'm not tired from this. I don't have like a treatment fatigue. Each day I look at my can, and I'm like so grateful that I can live. I look at my baby and this baby because of my meds. And you know, like even one thought that it can be finished tomorrow. It's like this is about me thinking about my death, my kid going to orphanage. You know, like my mama finished her days like in some government institution. So this is about my life, life of my family, and like what more global leaders need to know about their right decisions. I'm kindly ask Germany as a global leader, actually, as a European leader, really to increase the contribution. Just save me, my family, my lives. 150,000 Ukrainian citizens, 40 million global citizens. We just want to live, we deserve. Thank you.
Wow, thank you. Very touching last remarks. I'm glad that we recorded it because I think everyone in the world should hear that. That was very, now I'm becoming a bit emotional. But I want to finish as we come to the end of this engaging and insightful discussion. I want to briefly summarize our key takeaways. First of all, the spending cuts have already caused many catastrophic disruptions, and we heard firsthand examples from Ukraine and Zimbabwe. The health impacts are devastating, and not only the aid cuts, but also the confusion around the waivers have caused total chaos, which is extremely tough because it's not just services closing, but entire systems crushing. Furthermore, the mental health impacts are also very severe, for example, because stigma increases and medications are running out. However, it is not just the health-specific SDG 3 that deteriorates, but other SDGs as well. For instance, due to stark negative effects on gender equality and the fight against poverty. Yet, at the moment, the situation is still dynamically changing and is not yet completely clear which life-saving programs are going to be slashed permanently. Problematically, many European donor countries are slashing official development cooperation as well, even though what is needed now is a similar push for significantly more resources for global health, as we have seen in the field of defense. At the same time, it is paramount to increase financial resources from other sources, namely domestic resource mobilization, other high-income countries, and debt swaps, and prioritize the remaining financial resources. As a silver lining, important and globally working financial instruments such as the Global Fund already exist and just need the necessary funding to continue their very important work. And considering all this, we as advocates for global health have our work cut out for us to address the problem and press for solutions.